Nagre-record na dyan sa inyo.
Opo, Dok.
How about my highlighter pa rin. My little pen here. Can you see this one?
Yes po, Doc.
Okay. So our topic for today will be infectious diseases of pregnancy. So we're done with how the fetus is being formed until it will be delivered via parturition. And let's talk about what are the infectious diseases during pregnancy. So bakit ito importante, or why this is very important? Because infectious diseases, when it affects pregnant animal, it reduces the reproductive efficiency because there are infections that could definitely result to abortion. We have also stillbirth, mummification, embryonic death, as well as infertility to the parent. So I've mentioned this one. We have abortion here. And another is it will cause or it will be teratogenic to offsprings. When we say teratogenic, ano na ulit yun? Oh, wait lang ha. Ay, close ko lang yung pinto at ang lalakas ng tawa ng mga estudyante sa labas. Alright. Ano nang ibig sabihin natin ng teratogenic, class? In your patho? So some of the infectious diseases in animals are teratogens. When we say teratogens, this will cause ano?
Abnormality po, Doc, sa fetus po.
Alright, very good. So this will cause abnormality to the developing fetus until ma-deliver siya. So say for instance, we have pocomilia. What is pocomilia? In your embryo naman. This is a developmental anomaly that can be caused by teratogens. Pag sinabi nating pocomilia, ibig sabihin yung kanyang digit ay pwedeng putol. Kaya nga yung tinatawag ninyong pukol, ganun siya. And marami pang iba, like we have the syndactyly. What is syndactyly? So, na-encounter na ninyo itong term na to. Pocomilia, we have amelia, we have syndactyly, we have polydactyly. Ano pa? Marami pa niyan sa embryo ninyo. So, pocomilia is reduction of the digit. Amelia, totally no digit or no limbs. Syndactyly, we have fused digits. Polydactyly, we have numerous digits. So, ito yung nakikita ninyo yung may mga extra digits sa thumb. Ayan. Yung iba naman, syndactyly, webbed yung kanilang paa. Yung iba walang limb, yung iba pukol. So these are some of the teratogenic effect of bacteria. Okay? And syempre, if we are in livestock production, this will cause economic loss sa farmer. So the following slides will show you different bacterial and viral infection. So Oops. Yan. So let's go with bacterial diseases. One is we have the vibriosis. Vibriosis is caused by Campylobacter Campylobacter species of bacteria, like we have the Venerealis and we have the Fetus. And these are the specific animals that could be affected by this species of bacteria. We have the large ruminant and then we have the small ruminant. So these are the effects of vibriosis in this species of animal. Embryonic mortality. When we say embryonic mortality, namamatay, no? Namamatay yung developing embryo. And possibly, we have also the early abortion. Early abortion. And last, we have for the sheep, this will be abortion during the last trimester. When we say last trimester, that could be kailan? Ha? Last trimester ng pagbubuntis ng sheep. Anong edad yon? We have at least 50 days, last 50 days of pregnancy, pwedeng mag-abort yung fetus doon. And we have also the leptospirosis. And these are the species that could affect sa ating mga livestock animals. We have the Pomona, we have Canicula, we have the Gripotyposa, Icterohemorrhagia, Harjo, Serio, Pomona, and Harjo again. For swine naman. Okay? And pare-parehas lang yan ng mga yan. Ang effect nila will be abortion. When we say infertility, ano yon? Ha? Infertility. Ano ibig sabihin niya?
Doc, hindi po makakapag-produce ng offspring, Doc. Pero not
Yeah.
totally naman po na.
Alright, so this one is different with sterility, right? For your sterility, totally not capable of producing offspring. But for the infertility, maybe there is a problem, like we have low numbers of spermatozoa, or incapability of the sperm to fertilize the ovum, that one. And this could be enhanced by giving supplements, okay? And we have also the weak cows and late abortions as well. So for the horses, they have the same as with the swine. We have the Pomona, Harjo, Bratislava, and Icterohemorrhagia. We have the brucellosis. Okay. So these are bacteria na kung saan ay it could be transferred from animals to human. So in your epidem, do you have epidem?
Tapos na po, Doc.
Okay. What is the specific term for this type of disease that from animal, it will be transferred to human? Specific zoonotic term. Ha? In your embryo, in your epidem, what's that specific term?
Hindi po yung zoonotic, Doc.
Ha?
Hindi po yung zoonotic disease, Doc.
Anong specific term na zoonotic disease? I know that is a zoonosis or zoonotic disease. What specific type of zoonosis? Ha? may
Anthrop.
circle at sa mamaya. Miss Ortiz, ano ulit?
Doc, anthropozoonosis po pag po sa animal to human po.
Sure yon, animal to human. Nine. So let's dissect, no? If my memory serves me right, i-correct nyo na lang ako kapag wrong. Anthropozoonosis and zooanthroponosis. Zooanthroponosis, based doon sa aking public health teacher, Dr. Clarissa Domingo, this one is from animal to human. Zoo is animal, anthropo is human. Whereas anthropozoonosis is from human to animal. Anthropo is human, zoo is animal. So kapag ka sinabi natin from animal to human, yes, that is zoonosis, but the specific term for that will be the zooanthroponosis. Okay, so we have the brucellosis. The causative agent for that, syempre we have the Brucella abortus, we have the melitensis for small ruminant, and we have the suis for swine. And the effect will be, we have premature birth, we have the abortion, weak offspring, retained placenta, reduced breeding efficiency, and we have also abortion for this group of animals. But we have also in dogs din, Mamaya makikita ninyo yung specificity nitong sakit na to. Next one, we have the Listeria monocytogenes, or we have the circling disease. And these are the species affected. Mostly, they are large and small ruminant. Why? Because they could thrive in silage. Now, that's why ang ibang term dito sa sakit na ito ay we have the silage disease. The silage disease. And these are the clinical signs. Late abortion, retained placenta, and we have also the metritis. Okay? And we have mixed infection. So non-specific uterine infection, we have different variety of bacterial organisms. We have Staphylococcus, we have E. coli, we have Streptococcus, we have Bacillus that could cause, inefficiency in reproduction. Like we have extended anestrus. Syempre ayaw naman natin ito kasi kapag breeding farm tayo, sayang naman yung pinapakain natin doon sa specific animal na ito kung hindi siya maglalande. Okay? Or hindi siya magbubuntis. Okay? So we have this one also, Tylorella equigenialis genitalis, another bacteria species that could affect horses. And this is the name. So please do take note of the name and the synonyms. So the clinical signs, we have puro inflammation of the reproductive tract, like we have endometritis, we have cervicitis, and then we have the vaginitis. Another one, it's not bacteria, but it is a protozoan disease. We have the trichomona. Okay, so inyong parasitology, we have the Trichomonas pitus. Okay, we have also the bovine trichomoniasis. Siyempre, from the name itself, the species affected will be the bovine or the cattle. And these are the signs or the effects on reproduction. Like we have early abortion kapag kabuntis, or if hindi naman buntis, we could have pyometra. What's pyometra? What is pyometra?
May pus po sa uterus po.
Yeah, there is this presence of pus in the uterus. And based sa experience ko nito sa mga cases ng pyometra, treat mo siya ng antibiotic, treat mo siya ng oxytocin kapag open type ha, gagaling pero babalik ulit. So the best will be ovariohysterectomy because sometimes this pyometra could be triggered right after the estrous cycle. And we have also the sterility. Okay. For the toxoplasmosis, we have this gondii or the Toxoplasma gondii. It's not just only the small and large ruminant plus the swine, but we have also in cats or small animals. That's why karaniwang precautionary measures kapag ka mayroong buntis na tao, supposedly hindi na sila muna dapat naghahawak ng mga pusa. Kasi kung minsan ay subclinical itong toxoplasma sa pusa, hindi na natin alam na meron pala siya, na kapag ka nahawakan ng buntis na human or yung owner niya, possible na magkaroon ng abortion. Okay? So we have the effects on reproduction, we have abortion, we have weak offsprings, stillbirths. Ano tong stillbirth na ito? Anyone?
Doc, yun po ba yung pinanganak na pero patay?
Pinanganak pero patay. Ano yung pinanganak na yun? Buhay o patay? Habang pinapanganak?
Patay yun, Doc.
Abortion yun. Kasi ang stillbirth, pinapanganak siya na buhay, namatay siya during the delivery. That's stillbirth. Kaya sa farm ng mga swine farm, for example, ang ginagawa ng mga caretaker kapag sinabi nila na ang ginagawa ng mga vet, sabi lang ng teacher ko to dati, ang ginagawa ng mga vet kapag nag-report ang mga animal caretaker nila na stillbirth po yan, doc, sabi, ang papagawa, ipapadissect yung fetus, and then kukunin yung lungs, ipapalutang sa tubig. Kapag lumutang yan, ibig sabihin naka-inhale yan ng hangin. Buhay siya habang pinapanganak. Pero kapag lumubog yan, hindi pa yan naka-inhale ng hangin. Yun ang practice na ginagawa sa farm daw noon. Okay? So for stillbirth, buhay pa siya habang pinapanganak, namatay lang siya during the delivery. Okay? Iba ang stillbirth, iba ang mummification, iba ang embryonic death. Tatandaan ninyo iyan. Okay? And we have also the retained placenta. Another protozoan disease will be the neosporosis. And this one is in cattle. We have the Neospora caninum. And syempre, abortion in all stages of gestation. First trim, second trim, or third trim man yan, ia-abort niya. Okay? For the viral diseases, we have the BVD. For the cattle, we have this bovine rhinotracheitis or we have the pustular bulbovaginitis sa cattle pa rin. And we have the rhinopneumonitis in horses. So lahat ng iyan is a viral disease that would cause abortion. Abortion ito sorry. And we have also the abortion. Okay. We have also the viral arteritis. We have the blue tongue in small and large ruminant. And we have also the pseudorabies. What's the synonyms for pseudorabies? Anyone? Can you give me pseudorabies? But anyway, the signs of these diseases are, for the horses, kapag meron siyang viral arteritis, that could be abortion during the second half of gestation. And for the blue tongue, it's the CNS of the fetus. So pwedeng merong malformations then during the delivery, or it could cause teratogens. Or this one is teratogenic. And for the pseudorabies, we have the mummified fetus. What's mummified? Ano yung mummified fetus?
Doc, yung namatay po sa loob nung ano yung fetus, Doc, then parang na-dehydrate pa po. Ano.
Yeah, so that is the process of mummification. And embryonic mortality, syempre embryonic death yan. Stillbirth and abortion. Now, balik tayo. What is the synonyms of pseudorabies? Can you give me one? Bigyan nyo nga ako ng isa. Synonyms for pseudorabies.
Ojeski disease ba yun, Dok?
Yeah, we have the
80.
Ojeski's disease. Another, we have
Alpha
Ojeski's.
herpes virus po, Dok.
That could be the causative agent, but we have also the mad itch. Ojeski's. I don't know if that's the correct spelling. Ano, pakitignan na lang. Mad itch. Yan ang mga different synonyms for pseudorabies. Mad itch yan, sorry. Mad itch. Mad itch. Okay. And we have the PRRS, or the porcine reproductive and respiratory syndrome for swine yan. And the causative agent, syempre, the PRRS virus. And yeah, similar with the porcine parvo, we have the SMEDI, or the stillbirth, mummification, embryonic death, and we have the infertility plus respiratory signs. Have you encountered this one, or may mga narinig na kayo na mga cases ng PRRS sa farm? Ha? Meron na kayong na-encounter na ganyan? Nag-OJT na kayo?
Hindi pa po, Doc.
Ah, hindi pa? Fourth year na kayo ah.
Next year po ata, Doc.
Kasi kami may OJT kami ng third year kasi eh. Nag-OJT kami sa Pampanga during our third year. Kasi kumpleto na namin lahat ng animal production that time. And swine farm ang napuntahan namin sa Minalin, Pampanga. Ang ginawa doon, kwento ng farm vet, ay yung mga suspect nila for the PRRS, kinuha yung lungs, kinuha yung female reproductive tract nung namatay na sow, tinadtad nila, tinadtad, and then pinakain doon sa mga susceptible animal. I don't know what's the correct term na ginamit nila, parang feedbacking. This is to stimulate the immunity of the susceptible animal to mount resistance dito sa sakit na ito. And nag-work naman daw. So that's the PRRS, feedbacking. Okay? Another one, we have the fungal infection. We have Aspergillus species of bacteria. And not just only cattle, but we have also small ruminants as well as the companion animals. And expected that it could have abortion during the middle and the last trimester of pregnancy. So we have the fumigatus, we have absidia, as well as we have the mucor. So these are just example of mycotic infection in cattle that could cause abortion. So we have another one. We have the management for the PRRS. We call this as the MAPREBEL. Why is that so? Because this one stands for management changes. Ito pala, to reduce exposure to bacteria, to eliminate losses. Okay? So ang ginagawa diyan ay kapag ipinanganak na or nag-survive yung mga puppy tuloy, yung mga ano yan tawag sa offspring? Piglet. yung mga piglet ay kino-cross foster sila doon sa mga uninfected sow na nagpapadeded. First 24 hours of life. Para hindi na nila makuha pa sa milk yung virus and freeze yung mga animals or yung mga mga sow and piglets doon kung nasaan man sila, wala munang movement. And aside from that, yung mga susceptible or nagko-cross foster dito, eto na, ini-eliminate muna sila. Ini-eliminate muna after mag-foster. And at the same time, yung mga mahihina na, yung mga may clinical signs na, nai-euthanasia sila. Nai-euthanasia sila. And sinong may mga baboyan dito? Backyard farming. Have you practiced yung injecting iron dextran on the 3rd or 5th day of life ng piglet? Pina-practice pa ba yon? Kasi may principle behind that sa inyong swine production, kaya required na mag-i-inject ng iron dextran during the first 5 days. That's a 5th day. Nag-i-inject kami sa Pampanga before kasi in the colostrum or in the milk of mother, on the 5th day, bumababa yung level of iron doon. Kaya bibigyan mo yung piglet, injectionan mo na kaagad siya ng iron dextran. So that's the principle. And with PRRS, i-minimize yung handling of stressors. Kasi yun, sige nga, can you give me what are the management na ginagamit sa piglet during the first week of life sa inyong swine production? Can you give me? Kapag kalalaki yan, ano yung mga basic na ginagawa commonly? Ano yung ginagawa during the first week of life ng piglet? Male piglet. Mga management practices.
Castration ba, Doc?
Castration. Ano pa?
Yung milk teeth clipping pa yun, Doc.
Needle teeth clipping, tail ducking.
Needle teeth.
Ano pa? Kapag extensive ang inyong production, meron pang ear, notching. Ear notching. Ayan, so these are stressors. But for the PRRS, freeze muna yan. Wala mo nang gagawin sa piglet. And syempre, with this one ay yung mga runt or undersized piglet ay hindi mo na isasama doon sa litter na uniform ang size. Dito sa lecture na to, stop all biological feedback programs. Pero ito ay pinractice doon sa Pampanga na pinag-OJT-han ko and nag-work naman. So siguro, ang mechanism dito or ang principle kaya pinastop ay para maiwasan yung pag-spread or ng halimbawa ay hindi healthy or physically healthy yung tsura ng animal pero meron pala siyang ongoing na infection. Kaya pinapastop ito. Pwede kasing lalong matrigger yung infection. Pero kapag ka-healthy naman yan, pwedeng mag-mount ng immunity. And of course, we have the all in, all out. Anong ibig sabihin nitong all in, all out na to? What's the meaning of this one? And syempre, we have the disinfection. All in, all out, ibig sabihin kung sino yung unang lumabas, siya din yung, unang pumasok, siya din yung lalabas lahat. No? Kung sino yung mga pumasok, sila din yung lalabas. Parang FIFO din, first in, first out na nangyari. Okay, so that's the MAC-REBEL. Management of changes in, ano yun? Management changes to reduce exposure to bacteria to eliminate, PRRS, MAC-REBEL. Okay, so let's go with, ayun na, isa-isahin na natin yung mga common na sakit. So we have the brucellosis, and these are the synonyms for this. We have the undulant fever, we have Mediterranean fever, we have abortus fever, contagious abortion, and we have Banks disease. Banks disease. So name yan ng Dutch veterinarian na nakadiscover ng sakit na ito. Okay? So it could be acute. Sabihin na acute, mabilisan, or we have the chronic disease. And after introduction the microorganism or this brucella to susceptible animal, there will be septicemia. Ano ibig sabihin ng septicemia? Ha?
Yung infection po, Dok, napunta na po sa blood? Or systemic na po?
We have kasi three terms eh. Bacteremia, septicemia, and toxemia. Can you differentiate the three? Bacteremia, septicemia, and toxemia. So, when we say bacteremia, the bacteria is present in the bloodstream. But when we say septicemia, the bacteria is already reproducing in the bloodstream. And when we say toxemia, this multiplied bacteria is already producing toxin in the bloodstream. So that's ayun yung difference ng tatlo ha. General kasi yung nabanggit ni Mr. Kides na yung bacteria po ay nasa system na ng katawan ng infected individual. Okay? So right after multiplication in the bloodstream, there will be localization in the lymph nodes. So they will invade the lymph nodes. Mamamaga ngayon yung lymph nodes. And we all know in your anatomy that the lymph nodes is one of the basic components of lymphatic system that is connected in the circulatory system or the cardiovascular system. And ang predilection site nila right after invading this lymphatic system will be in the genital organ. In the genital organ. Okay. So this is an example, or these are the examples of brucella, causative agent, abortus, melitensis, and obese. So they are obligate parasites, or they are obliged, to consume or to parasiticize the reproductive organ ng infected animal. And each species of this ay meron siyang preferred host. Like halimbawa itong abortus kasi, karamihan yan we have in cattle, we have in companion animal. Yan. Obvious, syempre, we have in cattle, sheep, we have canis, yan, sa dog, etc. etc. Maraming yan, no? And the transmission of this, we have horizontal and then we have vertical. In your epidem, paano ang horizontal transmission or paano ang vertical transmission?
Dok, pag horizontal po, from the environment to the Dok, yung susceptible organism. Pag vertical po, Dok, from mother to the fetus, Dok.
Okay, very good. Please do remember the lines. Horizontal, tama ba ang horizontal pag ganyan ba?
Yes, Dok.
Ibig sabihin, nakukuha ng susceptible animal yung organism sa environment. Pero pag sinabi nating vertical line, ito ang nanay, andito ang anak. So napapasa from parent or from mother to offspring. So horizontal means could be, say, ingestion of organism from the environment. And we have also the penetration to the skin, lalo na kapag ka merong wound yung animal, not just only the skin, but we have also in the natural orifices na expose ang mucous membrane, like we have mouth and then we have the eye. And we have also the other contamination. Other, UDDER, lalo na kapag ka nakahiga yung animal na nagpapadede or lactating, open ang mga teat canals, pwedeng pumasok doon ang bacteria. And we have also coitus. When we say coitus, this one is the sexual intercourse or even artificial insemination, lalo na kapag ka hindi na tawag dito, hindi na nakita yung quality ng similya or nakita yung pinagkuhanan ng similya. For the vertical, that is via placental transmission. Pathogenesis, the brucella will enter the body, and at the same time, this will invade the lymph nodes, which is discussed earlier, and we have the lymphadenitis or inflammation of the lymph nodes. After invading the lymphatic system, since they are obligate parasite, particularly intracellular, they could invade inside the phagocytes. So what are the phagocytes? We have your neutrophils, we have your monocytes, yan. We have your macrophages. So kapag ka nakatago na sila doon or nakapasok na sila doon, hirap nang ma-recognize ng immune system. That's why meron tayong chronic disease. However, kapag hindi pa nila napapasok yung mga phagocytes natin, they could be easily recognized by the immune system, magkakaroon tayo ng acute contagious disease form. Okay, so right after invading these phagocytes in male, pupunta sila sa testicle. Kaya meron tayong signs ng orchitis. What's orchitis?
Inflammation of testicles, Doc.
Yeah. Kaya ang anong medical term ninyo for castration? Mamaya magka-castrate daw kayo. Class, what's the medical term for castration? Gagawin na ninyo yan mamaya. Dapat
Orchitomy? Or parang ganun. Basta may tumi, Doc.
ano nga? We have the orchectomy. Magbasa ha. Orchectomy. Orchiectomy. Yung iba kasi nababasa ko orchectomy. Or ORCHECTOMY. Or yung iba, orchiectomy pa. Meron pang I doon sa ORCHIECTOMY. Okay? So yan, kapag ka lalaki, alangan naman magka-abort yan. Hindi naman nagbubuntis ang lalaki. So inflammation lang ng testicle lang ha, pero once na na-breed niya ay susceptible female, pwede niyang matransfer yung organism doon sa kanyang testicle. Okay, so not just only the testicle, but we have also the accessory sex gland, like we have the prostate gland, we have the seminal vesicle, okay, and we have the ampulla. Then after invading this, we have the bacteremia again that can last for months. So ibig sabihin, nasa loob na niya, nasa blood vessel na niya, or nasa dugo na niya yung microorganism. And in female, sa uterus naman ang tama niya. Kaya meron tayo kung minsan endometritis or po pwedeng merong abortion. Okay, endomyelitis. Can you just search, class? What is this specific chemical agent na present sa uterus na kung saan gustong-gusto ng Brucella? Meron yan, kaya dyan ang predilection site nila. Yan ang kailangan ng Brucella para makasurvive sila. Kindly look for that one. Okay? And these are the lesions. Aside from ulceration of the endometrium, we have, ito na, walls of the uterus are having the initial lesions, as well as if the animal is pregnant, pwede siyang pumunta na doon sa placental cotyledon and destroy the villi. So in that way, wala nang means of exchanging nutrients and gases from mother to offspring. Mamamatay yung fetus sa loob. Okay? And syempre, it depends naman yung ang tawag dito. It depends kung intense yung infection, ano? Meron kasing nagsusurvive, merong namamatay during the development. So we have the abortion, stillbirths, yan. Sa sobrang hina nung offspring, nung ipinapanganak siya, doon siya namatay. Okay? And we have also the premature or weak calves. And yeah, right after the abortion or the parturition, magsished yung nanay. Magsished. And lastly, doon sa mga magsusurvive naman, permanent carrier sila. What is permanent carrier?
Nasa
Anyone?
body na lang po nila yung doc. Yung bacteria then parang hindi na po sila nagpapakita ng clinical signs or subclinical na lang.
Then, are
Pwede
they
po silang makapag-infect.
infectious?
Yes, doc.
Okay, very good. So these are the permanent carriers. Kapag naka-recover sila sa sakit na to, ibig sabihin, nasa kanila na yung bacteria, pwede na nilang maipasa sa kanino mang susceptible na kasama nila. Okay, so summary ng pathogenesis, infection, we have invasion of the lymphatic system, and for the non-pregnant, kapag hindi pa siya nagpapadede, pwede niyang i-invade yung other. And if lymphatic system ang tinamaan at buntis yung animal, there could be abortion. Ayun, ito na. Sorry for the substance, ito na yon. This is the erythritol. This is the substance that is needed by Brucella to survive. Kaya gustong-gusto nila doon sa uterus. Okay? Please remember this erythritol. Sometimes, classical question yan sa mga board exams. Alright? So, clinical signs, abortion after 5 months sa cattle. And this is mid-pregnancy. And then we have the late pregnancy. This one is the premature. Pwede ito kasi ay weak calves or stillbirth din. So metritis is one. Kapag ka merong metritis, pwedeng hindi na siya magbuntis muna because inflamed yung kanyang uterus. Retained placenta as well right after delivery. Pwedeng magstay ang placenta doon, mabulok at mag-cause ng septicemia again and toxemia. So, ang ginagawa dyan na management ay nag-i-inject sila ng mga, ano ulit yan? Ecbolic agent. We have the ecbolic agent. Like, these are agents that could enhance contraction of the uterus to eliminate yung mga content niya para malinisan. Example will be, we have oxytocin. Yan, ecbolic agent yan. So kapag ka merong Brucella din, expected that there will be decrease in milk production. And for the bull, summary na lang to ng mga clinical signs. We have orchitis, epididymitis or inflammation of the epididymis. And those that could survive will be a potential carrier and permanent carrier. Okay, sterility is one also. Totally hindi siya makakabuo ng offspring. And yung mga naka-experience na ng brucella na cattle, sabi diyan ay kapag nagbuntis ulit sila, magtutuloy ang pregnancy pero may mga effect siya doon sa mga mabubuo. Like we have weak calves, may mga anomalies, yan. So pregnancy is carried to final term naman. So pwedeng maliit, pwedeng run, yan siya. Okay? So in human, kaya siya tinawag na undulant fever kasi ang signs na makikita mo diyan, lagnat. Pero ano 'yon, nag-OJT din kami sa PCC before. We are handling large ruminant cattle, syempre Carabao. Bobaline, Philippine Carabao Center. Kadikit lang kasi ng school namin 'yon. Third year pa rin. Pinagdo-double gloving kami kahit blood collection lang kasi we will be conducting ito yung pang screen namin RBTT. We have the Rose Bengal precipitation test, no? Dugo ang kailangan namin diyan, serum. Titingnan namin kung may clotting. So kapag ka natamaan ang tao, there will be malaise or generalized weakness at saka fever, as well as headache. Yan siya. Okay. So upon necropsy nung namatay na animal at buntis siya, makikita mo since they are invading the placenta or meron siyang mga erythritol doon sa uterus, edematous. Okay. And po pwedeng na-consume na ng bacteria yung portion ng chorion. Na-consume, nag-establish sila ng kanilang colony doon, kaya makikita mo parang patsi-patsi yung kanyang chorion. And we have also nabubulok na yung cotyledons. Ayan ang itsura ng necrotic surface ng chorion ng infected na animal kapag ka nag-necropsy. Ayan siya. So placentitis, inflammation, edematous of the placenta. And ayan. Ito naman ay hindi na siya sa brucella but same as mga signs din like edematous na mga cotyledons here or placenta. Ayan. Toxoplasmosis, ganitong itsura niya, white flakes. Ayan siya. Campylobacter, granular appearance niya. Doon sa liver, liver ng aborted fetus. Pero ito ay nasa yung placenta ng nanay. So maybe I should stop here and let's continue the discussion on Friday. Maybe online pa rin kasi lecture lang naman ito. Ang pregnancy diagnosis natin will be next week. Okay, magdala na kayo ng buntis na animal ninyo, dog or cat, no? Huwag kayo magdadala ng baka dito. Baka gusto niyo mag-rectal palpation tayo. Okay? Do you have any question? I know all of you are now excited in having your first surgical procedure, maybe for some. No? Mga magkaka-straight, galingan ninyo. May tanong?
Wala naman na po, Dok.
Okay, hearing none, can you just open your camera and let's have photo shoot for the attendance. Okay, in the count of 3, 1, 2, 3, and thank you for coming. Ingat sa pagpunta sa school and do your surgery well. Okay,
Thank you,
bye.
Doc.
Thank you,
Thank
Doc.
Thank you.
The recorded lecture will be sent in our Google Classroom. Ibibigay ko na lang siya kapag na-convert na. Thank you.